I'm Linda Lara from the Aspen Institute, and I'm very pleased to welcome you to the 11th Preston Robert Tisch Award in Civic Leadership. You'll hear more about the award as the program begins, but to start out, I would like to introduce and turn it over to the president of the Aspen Institute, Dan Porterfield.
Thank you, Linda. Thank you to all who helped to make tonight's gathering possible. It's so great to be here in person this evening, and at the same time also to know that we have a virtual audience, and we're very grateful to have this opportunity, I think for the first time in our history, Laurie, to do a hybrid award ceremony. The Tisch Award was created to honor Preston Robert Tisch and his legacy of leadership, public service, and philanthropy. This award honors an individual who embodies the spirit and values of Preston Robert Tisch, who's driving change in his or her community while championing the Aspen Institute ideals of inclusive dialogue, values-based leadership, and decisive action on the most important issues of the day. The award and the yearly program in our series, Conversations with Great Leaders, are supported through the generosity of the Tisch family. Steve, Laurie, Jonathan, Lizzie, and the Laurie M. Tisch Illumination Fund. Our honorees over the past 13 years include remarkable leaders like John Lewis, Billie Jean King, Darren Walker, Michael Bloomberg, Mitch Landrieu, Sonia Sotomayor, Wynton Marsalis, Misty Copeland, and Cecile Richards. Tonight, we honor another remarkable leader, Dr. Mitchell Katz. Thank you so much, Dr. Katz. Dr. Katz is president and CEO of New York City Health and Hospitals, the largest municipal health care system in the United States. Since his appointment in 2018, NYC Health and Hospitals has significantly expanded access to health care and now provides care to more than 1 million patients through hospitals, community centers, home-based services, and no-cost health insurance. That's amazing. Dr. Katz's work has really made a difference for the people of New York City, and it's included the creation of a comprehensive electronic health record system, an increase in the number of nurses working in the system, the development of a modern ambulance transport system, and the launch of new street outreach programs to improve the health of homeless women and men in New York City. All of these measures help set the groundwork for the public hospital system then called upon to combat the unprecedented challenges of the COVID-19 pandemic over these past 2 years. During the pandemic, NYC Health and Hospitals has more than tripled its ICU capacity, has helped establish the city's Test and Trace Corps, has launched one of the country's most ambitious COVID-19 vaccine programs. I can only imagine the leadership that's been required, the toll it's taken upon colleagues who work with you on the front lines and throughout the organization. You can only understand the empathy it takes to be able to do the work you do, and those are just some of the reasons why we're so proud to recognize you, Dr. Katz. Before I introduce the great Laurie Tisch, who will present the award to Dr. Katz, we'd like to show you a short video about the past recipients of the Preston Robert Tisch Award in Civic Leadership.
I think kindness and generosity was in my father's DNA. I remember so many acts of kindness from when I was young. Anytime anybody needed something, he would take out his little brown notebook and write a note and always follow up the next day. To one of the initiatives that he's most known for, Take the Field, which rebuilt 45 playing fields in every high school that needed one. I would say everybody who won the award for civic leadership in honor of Preston Robert Tisch, they all embody what the Aspen Institute is so well known for. People who embody and have gone from success to significance.
The arts in general provide us with an understanding of why we are alive. I try to tell young people particularly, the more you know about history, the more you know about yourself. And because you have to know how we got there, and then how do you want to shape the future.
But until you actually bear witness to feel what the people who you're trying to help are feeling, you're not going to be empathetic enough to really know what to do.
The best ways out of poverty is a job. So as Laurie talked about getting jobs, you have to go and create jobs.
So you must never, ever give up. You must never, ever give in. Never become bitter. Be hopeful. Be optimistic.
Let's really interrogate why there are so many homeless people. Why do we live in a society that produces this much homelessness? And what are the structural underpinnings that seemingly produce and reproduce bad outcomes?
I see every challenge of a tragedy as an opportunity to get up and figure out what we have to do right.
And as I've said to the country about race, you can't go over it, you can't go around it, you can't go over it, you have to go through it. And going through it's painful because you have to have conversations with people that you know and people that you love. But you got to go through it to get to the other side because there is a better place.
Step back and let people hear your experiences in order for them to learn and change. That's how people connect, like through experiences.
Doing work for social justice and being able to devote your life to public service is such a privilege. Yeah. And I think sometimes people think it's a sacrifice, but to me, it's the honor of a lifetime.
Pleasure to welcome Laurie Tisch to come forward to present tonight's award. Laurie is a trustee of the Aspen Institute and president of the Laurie M. Tisch Illumination Fund. She's a champion of the arts, education, mental wellness, community, film, and football. She's a leader for the Institute and for this community, and we are so grateful that you are one of our greatest champions. Thank you, Laurie.
Thank you, Dan, and good evening, everyone. In case there is any doubts in the room, I do not call the plays. I may start. This is for the New York Giants, but so far I have not called the plays. I just want to make that clear. So I have pages and pages here about Mitch, and I'd love to talk about them, but Dan did such a good job that I'm actually going to ad-lib, which is probably good news for you because then I'll be a little bit shorter and you'll have even more time to hear Doctors Elisabeth and Dr. Mitch. We do this award every year, as you've heard, and about a year and a half ago, maybe a little bit more now, we've all lost track of time, I got a call from our colleagues at the Aspen Institute, Rick, my executive director, and I did, about who we should honor this year. And this was when the Andrew Cuomo show was on every morning. And of course, Andrew was the first person who came to mind. And I said, I know him well. His sister is one of my closest friends, and I'm sure I can, get to him. And, he's awfully busy. He was awfully busy. And I said, but, I think I have a much better idea. Dr. Mitchell Katz, he is not as well known. He's not on television every morning. Right now, I'm sure you're glad that you're not as well known. But I said, this is a guy that is really on the front lines. And this was at the beginning when you had already done so much, but since then have done so very much more. And I'm glad I prevailed. And it's really such a great honor for me and my family to give this award to you. And just a quick mention of how we first met. So Dan mentioned that we're doing quite a bit of work at the Illumination Fund in the areas of in the areas of arts and health, and kind of where arts and health meet, and how the arts can help in different areas of health. And about 3 years ago, in 2018, we announced a very big initiative, which has now gotten bigger, but it was a $10 million initiative working with different aspects of the arts, how they can improve mental health and anything from patient relationship to mental health to stigma, aging, et cetera. And we had our first kickoff, which is where I first met Mitch, at Bellevue Hospital, where I had never been before. I was really awed by the size, by the beauty, by the public art in it. And I remember starting off the press conference by saying, I never thought I would start a conference or a speech by saying, I am so happy to be here at Bellevue Hospital. But it's been a tremendous partnership, and we're so proud of it. And part of the partnership this is just a piece of what we're doing with health and hospitals, but part of the partnership that we're doing with Bellevue and 25 other sites, 26 in all, is that we have commissioned 26 murals in every single New York City public hospital and nursing facility. The last one was finished about 3 weeks ago at the Health and Hospitals headquarters. Each of these, as people in this room know and have been involved, each of these murals, we had about 150 to 200 applicants for each mural, and each of them have been designed by the hospital staff, by the doctors, by the patients, or worked on. I had the privilege of working on about 3 of them, and really a community effort. And I see we have Barbara. We're doing a book, 4 pages for each mural because they're so beautiful and deserve attention. Barbara Haskell is here, probably the world's greatest expert on American art and murals, and is doing the foreword of the book. So it's, it started with my happy to be in Bellevue Hospital, and look how far we've come. So it really is, Mitch, such a pleasure to work with you and with your colleagues. And, it's partnerships like this why I set up the Illumination Fund. We're, in case you're wondering, we're not Bloomberg, we're not Bezos, but, our resources are mostly, not completely, but predominantly in New York City, and it's partners such as you in health and hospitals that make our resources really go a long way. So thank you for the work that you're doing. And again, congratulations. Adding to all of your honors is now another one, the 2021 Preston Robert Tisch Award in Civic Leadership. Before you come up and get your award, I'd also like to introduce tonight's moderator, Dr. Elisabeth Rosenthal, Editor-in-Chief of Kaiser Health, Kaiser Health News, which is an independent newsroom based in Washington, D.C., focusing on health and health policy, and that's part of the Kaiser Family Foundation. Dr. Rosenthal is a best-selling author. She spent 22 years as a reporter, a foreign correspondent, and a senior writer at the New York Times, a graduate of Harvard Medical School, and has also worked as an emergency room physician, and then became a full-time journalist. And I don't know if you know, but one of the, I'm going to introduce you to my daughter, who was actually up on that stage interviewing Cecile Richards and John Lewis, and she's a political strategist, but she has a new podcast, a little advertisement, called Pivot. And it's about women who were successful in their first careers, and then something changed in their life, and then they became successful in their second career. So with your permission, I would love to introduce you to her. So that's it for me. Mitch, come up, please, and get your accept your award. And Elisabeth, yeah, a little off script. Congratulations. It really is. Congratulations. An honor for me. Thank you.
hold these or these mics? Or?
Do we need to hold the mics, or probably we do because it's a webcast, so they'll need to hear it, even if people here would hear us without it.
Okay, is mine on? Yes. So the first thing I should say is Mitch and I were classmates in medical school. So
We were.
It's been too long since we last spoke, but and I'm thrilled to be here because I, as you heard, run a newsroom focused on health and health policy in D.C. And as I watched what was happening in New York in February, March, April 2020, I thought, oh my gosh, the country is so lucky that this is happening in New York first. Now, I know it didn't feel that way if you were in New York, but there is just no other city that has the public hospital system and the public health capacity that this city does. I now live in Washington, D.C., and I think it would have been a much greater disaster. So I think the whole country owes you and NYC Health and Hospitals a great deal for leading the way on this.
Thank you, Libby.
So I thought we'd start off with the personal and then go into the pandemic era. You know, what led you from Harvard Medical School to go into public health? As we were saying before, when we were both in medical school, everyone was supposed to be a physician scientist and do gene research. So,
Right, well, that clearly was not in the cards for me, the gene research. I always wanted to be a primary care doctor, and I'm very proud that I'm still a primary care doctor this many years later. I think what changed the trajectory for my life was working in public hospitals. So the very first day, you're an emergency room doctor, and the very first day of my residency, which I still can tell you is June 21st, 1986, was in the mission emergency room of a public hospital, San Francisco General Hospital. And what was immediately apparent to me was how the huge contrast between working in that hospital and working in the university hospital. The university hospital, everybody had 3 different doctors. At the public hospital, people came alone. At the university hospital, there were family members always around. Our patients were always alone. For our patients, the social issues always seemed much more difficult than the medical issues. But at the same time, it always struck me, but the social issues should be easier to solve, right? There should be a way to help people, and we would admit people who were intoxicated, and we would spend huge sums of money taking care of them, appropriately so, but then they would be discharged back homeless to the street. And it made no sense to me. And I felt that I wanted to spend my life figuring out what was the solution. And I think that was ultimately how I've come to spend my life in public hospitals.
and here you are.
Yes.
And here is New York with still a robust public hospital system. And I hope we've learned from the pandemic that other cities should reinvigorate theirs. Well, on to the pandemic. Can you tell us we talked a little bit early on in the pandemic. What was it like? When did you first realize that, there's a train coming down the tracks and we're going to be in trouble?
Well, I mean, my first thought was I had watched what happened in Wuhan, and the conventional wisdom was that the situation got so bad because there was so much secrecy, and that before anybody was cared for, that people were silenced, and that was the major problem. But it was when it hit Italy next, as you remember.
Yep.
So Wuhan was December, January, and Italy was January, February. And by then it was clear, well, wait a minute, Italy is not secretive about this. And they're running out of ventilators, and you'll remember there were stories about by Italian journalists about doctors feeling completely overwhelmed.
Yeah.
So I think that was the first time. I have to say, I'm inherently an optimist, which goes well with my kind of work, right? Because it'd be hard to do it, I think, if you weren't an optimist. But I didn't really, I thought, well, okay, but the New York City is a medical capital of the world. I mean, people come here, and that did help us. Yeah. The fact that we had more hospital beds and we're a more specialized center. I remember when the mayor said to me sometime as we were going toward March or the very beginning, well, Mitch, I hope you're prepared to do the hardest thing you've ever done in your career. And my first thought was, oh no, I lived through the worst years of the AIDS epidemic. Yeah. You don't understand, right? I was in San Francisco when AIDS was the leading cause of death of men, of all causes, higher than heart disease, higher than cancer, and of all men, not just of gay men, right? Of all men, because the density of death was so high, and we were going to funerals, multiple funerals a week, and my closest friends died, my closest work colleagues died, all of my patients died, right? It was a time of, amazing, amazing sadness in my life, which then with the emergence, you'll remember protease inhibitors, those who were not dead came back to life, and the world became a different place. And so my first thought was, well, I don't know, whatever this is, it's not going to be like that. And then, of course, it turned out to be like death on steroids, because what was different about it was the pace. Yeah. Right. That what I remember about those years of caring for people with AIDS was, how hard it was to tell someone that they had pneumocystis pneumonia, because in those early years before treatment, that was telling someone you're going to be dead in 6 to 9 months. But it was 6 to 9 months. Yeah. Right. The people who were, when I knew that there was really something different and that was going to overwhelm us, I got a call from the then head of Elmhurst Hospital, and he said, we've intubated 16 people in the last 2 hours. Now, intubation, that's, for those who are not physicians, that's where you put a breathing tube down someone's throat. In an average day in a busy emergency room, Helen is here from, what would you say, like twice a day, I think. Twice a day, you might have to intubate someone. Helen is our terrific, Helen Ortega, our terrific CEO of Elmhurst Hospital. Maybe twice a day. There's 16 people to come in a 2-hour period in an emergency room. And that just became the beginning of it. Some of the nights, it would be 11 o'clock, 12 at night. Sheldon, do you remember you and I talking on the telephone about, Sheldon is our terrific CEO of Kings County Hospital. And I remember I on the telephone late at night, and I'm saying, Sheldon, I need you to open more beds. And Sheldon's appropriately, working his staffing issues. He's looking at wards that had never been used before, and he opened them. Sitting next to him is Christine, who's the head of our facilities, who did amazing, amazing work. Christine figured out what to do, Libby, when our oxygen tanks, the oxygen requirement was so extreme that they were overheating. And we were running out of oxygen, not because we didn't have the oxygen, but we couldn't do the flow, and she figured out the answer. So each night had as it turned out, for reasons I'm not sure anyone understood, most people wound up coming in late in the day, probably because they were trying all day to ignore the fact that they were getting shorter and shorter of breath. And so each evening, we were moving ventilators around, and at one point we got ventilators to Lincoln Hospital, I think 40 minutes before we would have run out of the last ventilator, at that hospital, right? Because I had to keep them centrally because I didn't know where they would be needed, and there weren't enough that I could ever say, oh, well, we'll just put 30 here in case you need. Right? So every day we were moving around the ventilators, and we came, Lincoln, that was the closest we ever came. We came like 40 minutes from getting the ventilator in time.
Wow. And I think it was because I trained during the HIV/AIDS epidemic in New York. But this was a tidal wave compared to that.
Right.
I mean, it was the volume of
The
people
volume.
and the. Why was it? Well, you told us a little bit, but what else did you do in terms of moving around personnel, moving around equipment? I mean, this system is pretty unique nationally in that it's not cities are lucky to have a public hospital. New York has this whole network.
Right.
So,
Washington, D.C., has had a very famous public hospital that very proudly produced a large number of African-American physicians, closed. Philadelphia, City of Brotherly Love, closed their public hospital. Right. Milwaukee closed their public hospital. Sacramento closed their public hospital. Boston, the hospital exists, but it's no longer a public hospital. San Diego closed its public hospital. So you have all of these cities, and I mean, I think, what the pandemic showed was how in a public emergency, that's when you need your public system because you can mobilize them in ways that you can't mobilize private systems, and also who comes to you, it's different. So one of the things I was most proud of in the more recent times about vaccination is all of our hospitals were vaccinating people for COVID, but when we looked at who we vaccinated, we were primarily vaccinating people of color, right? Because they were coming to us because we were the trusted place. That was why Elmhurst got overwhelmed first, because it's in the middle of a large immigrant community that trusted Elmhurst. It was a community where people were born there, and they went there when they were sick, and they knew that nobody would look askance at them based on their immigration status, and that we would have appropriate translators. So, I mean, just again, to give you some magnitude, Libby, we went from, in a 6-week period, we went from 0 COVID patients to 3,700 COVID patients.
wow.
We went from having 330 people in the ICU to 960 patients in the ICU. And one thing we did, and actually I'm not aware of any other city that did this, and you will often read that the hospital is out of ICU beds. You've seen that. We never ran out of ICU beds because I would just call Christine, and Christine would work with whatever hospital, and we would build more ICU beds. And Kim Mendez, who's there, she would be there with her staff cabling late at night because, of course, unless you have the electronic health record, right, there's nothing more that you can do. And it never occurred to me to think that we'd be out of ICU beds. If you don't have enough ICU beds, then you have to build more ICU beds. I mean, again, right, I've always tried to take a practical approach to what we do. I feel like it's not rocket scientist. What is a ICU bed? An ICU bed is having the right hookups and having the right staffing, especially nurses. Okay, so, Christine, build me another ICU. And she did. She had to. We never, I think, Libby, maybe it also helped, we never felt that we had any choice.
Yeah.
We felt that the patients kept coming, and the tradition of health and hospitals is we never turn anybody away, and we never turned anybody away in the pandemic. In fact, we took patients from other hospitals who got overwhelmed, and we just did what we had to do until it stopped.
Yeah. That's amazing. Now, what do you think COVID and the pandemic has taught us about preparedness? I mean, everyone would call me and go, why don't these hospitals have ventilators in the basement? And I said, that's not the way hospitals function these days. Hospitals function, they keep on hand what they need. no one prepares for something you hope never happens, right?
Right.
You don't have a storeroom of ventilators in the basement for something you hope you'll never see, but COVID was that thing. So what have we learned about preparedness for next time?
Right. Well, Kathy Wild's here from the business community. I mean, I think one of the things that's was hardest about it and needs to be solved is supply chain, right? That the assumptions in healthcare have been all about consolidation, that you have fewer and fewer providers in the hopes that the product is produced more efficiently. The US, and I know this is also true of Canada, even true of India, that countries stop producing things. In the case of India, or only produced it for export, right? But in the case of this country, various industries that would have once been robust in this country no longer exist. Yeah. And so all of a sudden, we had problems. I'll tell you, to light in the moment, a funny story about the COVID pandemic. I was helping to get a sufficient amount of PPE to the school system, especially for their nurses. And I have, Danielle's not here, but I have an incredibly talented purchaser. And she figured out a way in the midst of all of this to get us the gowns that were necessary. And I get a call they open up the box, and I get an upset call from the school district because there's a big note in the box that says these gowns cannot be used for infectious disease control. And they're saying, what kind of thing this is, Mitch? You sent us all of these gowns, and we can't use any of that. Don't you know what you're doing? And of course, that note was necessary to get them exported, because at the time, the country wasn't willing to export any PPE what could be used in that way, right? So, I mean, you cannot prepare for every emergency. But I think as a country, I hope that we've learned about the idea that there have to be multiple supply lines. And this was not the first time, and I think you've even covered, where hospitals have run out of a particular drug, right? Because there was only one person making it. And I think especially in healthcare where people need things, you have to have redundant ways of getting the things you need.
And did you run into, I know there were some very, as a journalist, ugly scenes of governors from different states bidding against each other for ventilators and driving up the price. Did you have to do any of that?
Absolutely, it happened. I mean, we were, in some way, we were first out of the gate.
Right.
So we the really bad time for us, there weren't any other, I mean, it was just the Northeast, the little Boston hit, not as bad as us, a little bit Connecticut, New York. So, I mean, the other way, the fact that New York was hit hardest because we didn't know anything, right? We didn't know anything, and we didn't have any testing capability, remember, at that time. But because we were the first, we were able to get help. See, part of the issue that people are dealing with now is places like Western New York State is that the current pandemic is so diffuse that people need help everywhere. One of the other amazing statistics, we credentialed 7,000 doctors, nurses, or other people to work in the hospitals during that period of time. Wow. 7,000 people. Some of them may have worked just a day. Some of them were so moved by health and hospitals that they stayed, right? Some of them went back to the South where they were working. But if we hadn't had those 7,000 people, because, of course, besides the flood, and again, I'm sure all of you are New Yorkers or know a lot of New Yorkers, a lot of us were sick. Right? I mean, I constantly had my doctors being sick. I had my nurses, my administrators, right? I mean, so I not only had to somehow staff up for this amazing volume that I had never had before, but I also had the challenge of dealing with a huge number of outages of people because they were sick, right, and couldn't come to work.
And can I ask you, did you lose staff during the pandemic?
We did. We had, I mean, there are many ways that I think people were traumatized, and some of the greatest ways were taking care of a fellow nurse, taking care of a fellow doctor. One of where Sheldon works, one of the Kings County emergency room doctors, was one of the best loved emergency room doctors, this amazing, amazing man. And so imagine what it's like, right, when you're in the middle, right, again, you know, fortunately humans, we have the ability to forget, and sometimes that can be a good thing. But remember, at this time, you know, almost nobody knew, you know, what was going on. I remember my deputy, Dr. Eric Way, he was putting in a lot of shifts, and after shifts he sent me a picture of him on one side of a plexiglass wall that his very smart doctor wife had erected between him and his children. And so he's on like one side of the plexiglass because he was, you know, confined to the basement, right? And his children are on the other side with their hands like this, right? I mean, none of us knew as we go through the hospital whether, you know, how it would affect us. I mean, knowledge, right? Just knowledge helped. I mean, even before vaccination, once it became clear what the precautions were that would make a difference, and we had sufficient volume, just that brought down, you know, the level of intense anxiety.
Did you have staff that died during the pandemic?
I did.
And how many people across the system?
You know, I think that it's in the 30, 40 range.
So significant.
It's a significant number.
Wow. And how did you deal with it? You had a child at home.
Right. I have my two children and my great partner, Gail Gurin. I mean, they were horrible times. I mean, I don't, you know, he remembers, right, I mean, it seemed to me, you know, and maybe take a moment to say, you know, when I listened to the people who've gotten this award, you know, personally, I don't feel in any way that I'm in the same class. I don't think it's relevant even as a comparison. But I think H&H is in the same class. I think health and hospitals. I think the achievement of health and hospitals during that time, the number of lives that we saved. We've done 7 million COVID tests this week. We've done 1 million COVID vaccinations. I think the work that health and hospitals did during that time was worthy. I think that my contribution, and I remember it in, you know, some of the conversations that I had with some of my staff who were here. What I did try to do, and I hope people felt it, was that if anything went wrong, it was my fault. Mm-hmm. Right, because we all needed to do, and I take seriously that one of the things that Preston Robert Tisch was known for was value-based leadership, and that's something I take very seriously. Is what are your values? And what I felt my value was during the pandemic was we were going to do everything that we could to save life, and if it wasn't in the rule book, we were still going to do it. And I think that there are multiple people in this room, because we came to it, you know, who heard me say, you know, we're going to do what's right, right? If anyone should later complain that this wasn't how it was supposed to do, I take full responsibility for doing it. It will be my fault, not your fault, because I wanted people to feel that they needed to do. And we had to do some things that were definitely not by the rule book. I mean, how else could you have created it? Just the ICU units alone, if I said to Christine, who's such a talented engineer, Christine, under normal times, how long do you think it would take us to create 600 extra ICU beds in regulated New York?
Yeah.
Right? It would be years, right?
Well.
But I do think that it was an amazing thing Health and Hospitals pulled off.
And you told me in some of our phone conversations that you even ended up taking some patients from some of the other hospitals, the private hospitals.
Yes, we did.
Can you say something about that?
Well, again, I think that it's the role of having public hospitals, right? So, who I'm working for, the mayor, for the city council, and no New Yorker is any less a New Yorker if they went to another hospital. And so we were all the time, there are a group of private hospitals who had the resources, but there were also a group of private hospitals that didn't have the resources, that run very narrow margins, that didn't have the same abilities. And we took their patients. We took them in transfers. I sent supplies to other hospitals. I sent nurses to other hospitals. And I think, again, it's why it's so great, to have, a public system, right? Because, then when there is an issue that involves the whole city, you have an arm, right? The reason Health and Hospitals did the testing and tracing, which was a little controversial and was a little bumpy, was because we had the operational arm. Right, it wasn't so much we did it all with our sister department, the Department of Public Health, but it wasn't really an intellectual problem. Right. It was an operations problem. You needed a big engine, the ability to hire quickly, to procure quickly, to be able to open sites quickly. And so when a city in a health emergency, when a mayor, a city council, a set of voters have a public system that is responsible to them, then that system focuses on whatever crisis it is. I'll make a quick detour to mention something that I really care about in Health and Hospitals. We are 20%, Libby, of the hospital admissions in New York City.
Wow.
We are 55% of the psychiatric admissions in New York City. Why is that? The reason is you can't break even on a behavioral health patient. It's not possible. You could run the most efficient operation in the world. You can't break even. And many people, understandably, don't find these to be the patients that are most desirable. They are very challenging to take care of, people who have to be involuntarily kept. But it's the mission, right? And if we don't do a good job, those people are going to be out on the street. They're going to die on the street of exposure. They're going to wind up in Rikers because they're going to commit small crimes in order to get sufficient food. So, the great thing about public systems is that you can then focus them on whatever the problems are that the population cares the most about.
And it becomes a true safety net. I have to say, as I go around hospitals in the country, I see many, many psychiatric patients boarding for weeks in emergency rooms because there are not enough psych beds. So there you go. Next, thank you again, Health and Hospitals, for doing that. What about when vaccines came? How did the staff respond? Was everyone like,
so
yeah,
I think there was an audible sigh of relief.
Yeah.
Right. I think people, again, because the risks that we all felt. I know seeing my own patients, I felt relieved to be able to. It didn't change what we wore, but it changed how we felt, and also the pleasure not only of feeling safe for ourselves, but of being able to vaccinate our patients. Right. What such a pleasure right, to have something so useful to offer people, that here we have this vaccine that's going to protect you from death. And especially for our older patients, it meant so much.
Did you face, you know, you hear across the country hospitals where a significant portion of the staff doesn't want the vaccine?
We did have vaccine reluctance, no question. Although in many ways it came from a different place. It did not, in us, it was not anti-vax.
Right.
In us, what it was a combination of a sense of, I've already lived through this. Right, that, you know, we're talking about, you know, nurses who were up to their elbows, you know, for months at a time, taking care of people with COVID. And I think many of them felt, I had it, I survived it, you know, I didn't need a vaccine for it. So it came from a different place. At the end of the day, when we said everybody needs to be vaccinated, and, you know, to me it's always the why do we get vaccinated? It's not just about us, right? It's about the other person in the room who perhaps has, you know, a kidney transplant, not an unusual thing, and is taking immunosuppressive medications and will never be able to mount a response to the vaccine, right? We have to get vaccinated, even if we're sure we'll do just fine.
And so now your rate is?
Well, in the hospital, it's 100%.
Great.
We don't, we allow,
yeah.
Of course, we follow the law that there are medical exemptions and there are religious exemptions, but you don't get to come to work inside the hospitals. We have to find another way to work, or we won't, so the vaccination rate in all of our facilities is 100%. You don't get to walk into the door unless you're fully vaccinated.
Congrats. Now, we're running out of time, so my last question is, what are you looking at when it comes to Omicron? Are you like, oh, here we go again, or are you like?
Well, I mean, as you might imagine, Libby, I'm all things. I mean, I'm like, I want to take another step back, especially to all of you and to my staff, because I don't think it's understood how profoundly I believe people have been affected by COVID.
Yeah.
Iggy's dad died, you know, our own from COVID, our own children's response to losing their grandfather, right, far away. That people have lost people they love, the effect of being chronically anxious. Whether you're anxious because you're worried you're going to get sick, or you're not worried you're going to get sick, but you're worried all the time that you're going to spread something, perhaps to your elderly parents, to your child who isn't yet vaccinated, that we have all lived now for 22 months in this state of siege. And I believe it's had an effect on us. I mean, even among our own health and hospitals, I've had to have, you know, the conversation with people where we have a little bit of friction in the team. And, you know, I remind people, we've got to cut each other more slack. This has been a miserable time, and it's hard to know how we're all being affected. So there is a sense of, could this be happening again? But I'll go back and say, no, I'm an optimist. While, Libby, neither you nor I turned out to be the great bioscientists that our alma mater wished we were, you and I did learn some basic principles, and I always go back to them. The viruses don't really want to hurt us. Right. They just want to reproduce. Right. Hurting us is actually a bad thing for a virus. Ebola was contained because it was such a mortal virus that people would die before they could get very far. Yeah. So from the virus's point of view, killing you is not its goal.
Right.
From the virus's point of view, the best it could be would be to mutate into something more contagious and less lethal, because then it could just keep reproducing, right? If it could just constantly spread, but not hurt us. And again, remember that the virus that caused the Spanish flu epidemic is still circulating. The virus didn't go away, and COVID is not going away. But I'm hopeful. I don't know that there was.
That's my hope too. That Omicron turns
You saw
out.
today that South Africa was saying it's too early to tell, but it seems like people are not getting sick. It is too early to tell. But I do believe humans are an adaptive species, and that we will learn one way or another how to deal with this virus. And if it's every year we have to get a booster, then every year we'll go and get a booster. And if it turns out that at some point the virus, becomes less lethal, then we'll all be happy. What do you think?
Well, like you, I'm an optimist, so my hope is that it becomes just one of those cold viruses that circulates and we get vaccinated as much as we need to. Many of the experts I've spoken to feel like the boost is, will do well for, as is true of many other vaccines, will do well for years, if not a lifetime. But, I've been wrong. I think we've all been wrong about this virus at so many junctures in the last 2 years that we've all been humbled. But you shouldn't be, because you did a fantastic job.
Thank you. Health and hospitals did a great job.
Yeah.
Well, thank you all.
We have time for one or two questions. I knew you would have one, Laurie.
Well, thank you. Actually, I want to give you the award next year, too. Next year, we'll give it to Health and Hospitals. But quick question. You talked about or referred to the fact that the doctors and the nurses and the health professionals were under such incredible strain and stress. So I'm wondering, as somebody who runs a foundation, and I know Kathy Wild is here from the business community, what do you think their needs are, and how can we, in the philanthropic community, in the business community, what can we do? How can we be more helpful?
Well, thanks, and it's a great time to say thank you to the philanthropic community for all of the donations. I mean, that was one of the great things. I mean, and again, remember, those of us who lived through, those months, there were no restaurants, right? If we didn't provide food to people, how would they, right? They couldn't have worked the kind of shifts they had. So the philanthropic money bought food for the healthcare workers. It bought clothing and washing machines because people were afraid to go home in the same clothing that they came in, because we weren't exactly sure, whether clothing could or didn't transmit it. Public transportation was running very sparingly, especially at night. So we used the money, for transportation to get people Ubers. We used it for hotels because people were afraid to go home. Not everyone, like Eric, has a basement and a lucite wall, right? So people felt like they couldn't risk, right, exposing their family members. So we put up people in hotels. So the forward, I think, is the mental health issue, right? That people have been traumatized. That not everybody even is aware of how they've been traumatized. We have a lot of peer-to-peer support, but I think some people need more than that. I think the arts, and the Illumination Fund, healing is always well done through art. And mosaics was something we even did during that horrible time. But I think we need some help on establishing a designated mental health person so that people can feel they can talk confidentially. So Neil Moore here, who does a great job running Queen's Hospital, I would love if he could have somebody at Queen's Hospital who he could always refer people to, and they would know that it wasn't going further. People are suspicious. They don't want to go to a typical employee assistance program. They want something that they feel is separate.
Okay. Hold on. I'm coming.
Thank you. Kelvin Chan from the Robin Hood Foundation. I wanted to also put a star here to say that COVID response aside, there were still basic functions in motion, and that people are getting care other than for the purposes of infectious disease. And I want to celebrate that as well, because in this tremendous moment in the past 22 months, Health and Hospitals, too, under your leadership, has triggered quite a few tectonic shifts in the way that it conceptualizes care for patients and their families. And I wanted to hear from you about that story as well.
Well, thanks. My favorite example is our show vans. We started with these mobile vans to vaccinate homeless people. And what we found is that it turned into a great model for healthcare, which I had not appreciated, Libby. I've always been interested in the care of homeless people, but whenever someone has said, why can't you do street medicine? I'm always thinking, well, but I'm a primary care doctor. What am I going to do on the street, right? There's no privacy. I can't even undress someone to look at a wound. I have no pharmacy. So the answer, it seems like, is these vans, because people like them. We bring them in. We provide free snacks, free clothing, socks, T-shirts, and then now we've expanded that. Not only do we do the vaccine and COVID testing and dressing changes, but we're doing drug treatment, buprenorphine, and we're connecting them virtually with the psychiatrist or the addiction specialist, right? So, because we can't afford an addiction specialist to go in each van, but we can have someone centrally who's available. And now with the telehealth, which isn't the answer to everything. Please don't make, I do not, the months when the clinics were requiring me to do telehealth, I do it. It's not the same thing. It is not, I don't think it's as healing as being with a doctor you care about it or nurse you care about in the same room. But in a case like that, telehealth for the prescription, buprenorphine to get someone off street drugs, phenomenal. So I think, and I thank Robin Hood for all the ways you've supported us.
How did you get the money to buy vans? I mean, where was it? I'm sure you didn't have a garage full of HHC
interest,
vans.
And I give the city and the mayor a lot of credit. From the very beginning, no one ever asked me what anything was going to cost.
Wow.
I think that and again, Kathy from the business community knows, the loss of revenue of a close down to New York City is so ginormous that almost anything you spend, if it keeps New York City from shutting down, turns out to be cost effective, right? So, I mean, just because the losses, right? So, and we have had reasonable success from FEMA for paying for our COVID-related expenses. So that has helped.
Well, unfortunately, we're out of time, but I want to thank Elisabeth for marvelous moderation.
This was fun.
And
thank you, Mitch.
To congratulate Mitch Katz and New York Health and Hospitals again for the superb job you did bringing us out of COVID, and to Laurie Tisch and her family for putting forward the ability to give this great award every year. So thank you all for coming.